I'm going to tell you today about ADHD in women. Why this subject? Because there are many gaps in our knowledge on ADHD in women, and I thought that it would be good to summarize everything that we know about it. The publications, studies done, also my knowledge, because as I will tell you today, I would say I have quite a lot of experience in the subject, and so I will try to tell you today how we should see ADHD in women and what are the characteristic features of this ADHD in this gender. So first I want to tell you about myself. I am a psychiatrist working in Poland. I have lots of patients all over the world, in Poland also of course, but also all over the world because today we have video consultations, so I can consult patients everywhere, and I have around 1,400 patients with ADHD under my care from the age of 3 to 76. So as you can see, a very broad range of age groups. First, I want to remind you that ADHD was described for the first time in 1775 by a German physician called Weikart, Melchior Adam Weikart, who described a syndrome or a disorder, people who were losing attention, distracted by everything, even their own thoughts, who were finding it difficult to complete a task, who were careless, who were making a lot of mistakes, and who were disorganized. And he noticed right away that the disorder is more prevalent in children than in adults, but he noticed that it was present both in children and adults. There are three dimensions of ADHD. We can describe the features of ADHD on three dimensions. So the first one is energy levels, and the characteristic feature of ADHD is that people with ADHD have either lots of energy or low energy. They speak quietly and behave quietly sometimes, and sometimes are very energetic and very temperamental and have lots of energy. Then another axis is concentration. So people with ADHD, they either concentrate very well when there's something interesting for them and they concentrate even too much on the subject, or they cannot concentrate when there's something that's not interesting for them. And the third axis is impulsivity. So when there's something interesting for an ADHDer, she might want to start doing it right away and cannot stop doing it and cannot postpone the beginning of their action, while on the other hand, when something is not interesting, this person cannot start doing it. Sometimes patients say that they are paralyzed. Another feature of ADHD, the fourth feature of ADHD, is DESR, or deficient emotional self-regulation. This is the emotional side of ADHD, and other names of this feature are emotional dysregulation or rejection sensitivity dysphoria, or RSD. The clinical significance of DESR is usually very high. So around 30% of patients say that this feature is the most important one among all the symptoms of ADHD. So they say that this is the most important problem in ADHD, their emotionality. And as you can see, this feature is present in nearly all the patients. If you look at both genders, then you can see that high emotionality or emotional dysregulation is usually higher in women. So around 57% of women with ADHD say that this is the feature that affects their everyday functioning, and around 39% of men say the same, so that they say that this is very important and strongly affects their everyday life. This result is from the poll from a group, a Facebook group that I run for my patients. I have a few Facebook groups. I encourage you to join them. One of them is in English. It's called ALMA, ADHD in Adults. I encourage you to join it and to learn more about ADHD, because I try to disseminate this knowledge and help my patients through the Facebook group. What is the prevalence of ADHD between men and women? So for many years we thought that ADHD was only present in boys, in young boys. As you saw, and Weikart already said that it's present both in both genders, and that it's present also in boys, in young children and in adults, while later during the course of history it was somehow only thought that only young boys have ADHD. Only with time we understood that ADHD is a lifelong disorder and that both genders have ADHD. So for a long time we thought that women simply have hormonal changes and their behavior is affected mainly by hormonal changes, not by some kind of psychiatric disorder, and that they also have coexisting disorders like anxiety, depression, personality disorders, and this is the problem, this is the source of their problem, not ADHD. If we take a look at how many patients of both genders are diagnosed in the childhood and adulthood, you'll see that in children, among children, still around 80% are boys and only around 20% are girls, while in adults, in our clinic, because these are results from our clinic, so in adults this is more or less the same, so around 50% of both genders among our patients, adult patients. If you take a look at the official international classification of diseases, so there are two types of classifications. There's one in Europe, it's called ICD, and there's the one in the US, and it's called DSM. And as far as the European classification says that there are three subtypes of ADHD: hyperactive impulsive, the one with concentration and attention problems, and mixed type. The new DSM-5 new classification says there are no subtypes, there's only differences in presentation of ADHD symptoms. So all the patients are the same from the point of view of symptoms. And I think it's true. There are no subtypes, but officially there are. In Europe, there are. And so the classification in Europe says that there are those three types in patients, but according to some of the new studies, it seems that in adults it's much more reasonable to divide those adults into two groups: emotional patients and the ones with concentration and attention problems, that this is a better type of differentiation between patients with ADHD. But this is only for the sake of the argument, so you can see how we can divide the patients among children and adults. Now, today I will tell you about different symptoms of ADHD in women. As I said, I will try to summarize the knowledge on the subject. But first, I want to say that one should remember that every person is different and that there are very many symptoms of ADHD, except the ones that I mentioned here. And of course, different people will have different symptoms, and sometimes you may see some symptoms that I will mention today and think, I don't have it totally, and this is not me. That's normal. That's absolutely normal, because in every disorder or disease in humans there are some symptoms, and some of them are present in some patients and some of them in different patients. So that's normal. So today I will try to tell you about the most important and those most typical symptoms for girls and women with ADHD. But please remember that different people have different symptoms, and that's completely normal. So let's begin with what's typical, or what's quite typical for women with ADHD or girls with ADHD. Women and girls with ADHD have more problems in social interaction. As you can see, girls and women with ADHD have, for example, problems finding friends, striking up a conversation with a stranger, or approaching a stranger. This is a result, of course, of DSR, which is emotional hypersensitivity, and these girls are afraid to talk to a stranger because they are afraid of their reaction. If the person says something not nice, then the girl might take it strongly and take it deeply, and this may be a problem for her. So she will go back to this experience, this negative experience, and she may be suffering from striking up this conversation. So usually girls with ADHD are not very people's person, and they usually have a problem with finding a new friend, or getting into a new group of people. Another feature is strong feeling of rejection. This is, of course, connected to the previous symptom. So those girls often withdraw from social relations because, like I said, they are afraid of being judged. And this is also a problem because very often at school they get bullied because they are very prone and very sensitive, and other children can see that they are very sensitive to what other children are saying, and sometimes those children will do or say something on purpose to see that the girl is shy, or that the girl withdraws or run away crying. And so children with ADHD are quite often bullied, and they have problem in the interaction with peers. Girls with ADHD have problems in maintaining relations. So very often they are overwhelmed by their role as a mother, as a father, as a girlfriend, as a wife, sister, or friend, because they feel that they are expected to be a good mother girlfriend or a friend or sister, and they struggle because they try to be a good mother or sister, but doing repetitive things, jobs or anything repetitive in their life is quite difficult. As you probably know, it's quite difficult for an ADHDer to maintain the same pattern of behavior because they just get bored, and it's difficult, very problematic for them to do the same thing all over, all the time. Another problem is that they internalize their problems. So they tend not to go to their friends, let's say, and tell the friend that she said something that was not nice, for example. So they will internalize it and they will not share it with their peers, and because of that there may be a lot of misunderstanding and of course problems in the relation. They also have problems with maintaining relations because they are sensitive to negative comments. So if my friend says something not nice, or it may even be neutral in the significance or in the meaning, but I may take it deeply and I may think that she said something bad about me. So I may simply interpret their words as being negative, and then this might also be a problem because I may try to end such a relation with someone who, in my opinion, said something bad about me. Girls with ADHD have problems completing their jobs or tasks, the things that they are supposed to do. So, for example, at school they have a problem doing homework. First of all, because they cannot concentrate, of course, but also because when they get very easily distracted. So they start doing something, but they get distracted and that they cannot finish. Also, they get tired doing something because girls with ADHD usually have lower energy levels than the boys with ADHD. So it's tiring for them to do the same thing for an extended period of time. So it will be simply tiring, and they don't want to do something that makes them waste their precious energy, of which they have very little, quite often. And this problem is quite often misdiagnosed as low intelligence of those girls or low capabilities of theirs, because they cannot do things that they are supposed to do. So there must be some inner problem with them, and maybe they just have low intelligence or low IQ. While, like I said, it's a problem, or quite often a problem of energy, distractibility, and working memory problem, of course. So like I said, girls with ADHD have high distractibility. They start doing a job, but then quite easily somebody says something, or they hear something on TV, or their phone rings, or they get a text message, and this is enough for them to stop doing what they just started doing and do something else. So pick up the phone, for example. And another problem is that, for example, during a class at school, they simply drift away, so they start daydreaming or drawing, very often drawing something in their notebooks, and they stop listening to the conversation or to the teacher, and they just lose focus. So they are easily distracted. Girls and women with ADHD have memory problems. it stems from the fact that if we want to remember something, we have to concentrate on it. You cannot remember something that you just didn't concentrate on, and certainly you will not remember it, this thing, for a long time, or you might not remember it for at all. This is quite common in ADHDers, and this is sometimes a problem when we diagnose the patients, because as you might know, there are some questionnaires for ADHD, and in order to answer those questions in the questionnaire, you have to answer also the questions connected with your childhood. And quite often ADHDers do not remember large parts of their childhood, and sometimes this is a problem for making a diagnosis of ADHD. So because of many of those facts that I just mentioned, girls and women with ADHD have problems listening to other people, for example, during a conversation, because they get easily distracted and they drift away, like during the lesson that I just mentioned. Girls and women with ADHD sometimes get disorganized, so it's difficult for them to introduce some order into the chaos of their life. They quite often have problems with keeping their room in order. They have lots of things laying around, and it's difficult for them because they have low energy levels, so it's difficult for them to spend the whole day putting things in their place. And this is quite characteristic for the girls of ADHD, unless they have the perfectionist mask, which I will tell you about in a moment. So this disorganization is also caused by high distractibility. So even if they want to do something with their room, let's say something might happen and they just get distracted and start doing something else, or they take some shoes from their room, they want to put it in the hall, they go put the shoes in the hall, and in the hall a cat comes and they just start playing with the cat, and no more, they don't remember anymore that they were tidying their room. Another problem causing disorganization are memory problems. So if they don't remember, for example, where they put some pen that they were supposed to use to write up a plan for something, for organizing their life. So if they forget where's the notebook, where's the pen, and other things that they need to do the planning, this may also hinder the process. Another thing that makes it problematic for them to organize their life is that thing with time perception. I will tell you also in a moment that people with ADHD, both sexes or both genders, have problems keeping up with time. And also maintaining control of the task that they are doing is a problem for girls with ADHD, so they often get distracted and do not finish what they started to do. So, like I mentioned a moment ago, girls and women, and also boys, but this is characteristic, like I said, for both genders, they do not have time perception, or at least time perception is very fluid for ADHDers. So something that might happen in 1 hour is nearly something that might happen in 1 year. If it doesn't happen at the moment, it will be difficult for me to coordinate this time point in the future, because I see something that happens now, and everything that will happen in 1 month, 1 week, or 1 year is some future in the future, and I will find it difficult to coordinate something that might happen until this time, this point in time. So this is time perception is quite fluid and problematic. Another thing, characteristic for people with ADHD, in this case for girls and women with ADHD, are sleep disturbances. So mostly people with ADHD have problems falling asleep, and sometimes I must stress that these problems are periodic. So sometimes they have problems getting to sleep. It's not a constant problem. Sometimes it happens, and this problem results from the shift in melatonin secretion in our body, or in our brain to be precise. And people with ADHD, because all people without ADHD, so people in general population, have melatonin secreted in their pineal gland, and it's secreted when it gets dark outside. And people with ADHD secrete melatonin later, so the melatonin secretion happens later, and this is the cause of their periodic problems with falling asleep. So people with ADHD feel much better during the evening, because melatonin secretion is shifted, so it happens, let's say it starts instead of 9 in the evening, melatonin is secreted at 1 o'clock in the night, or at 2 o'clock, or 3 o'clock, or 4 o'clock, and it's shifted, so it's still secreted until noon, let's say. Melatonin is a strong inhibitor of our appetite, because during the night we do not need appetite. We shouldn't feel appetite, because then we will get woken up. So melatonin makes people with ADHD not eat breakfast in the morning. They do not feel appetite in the morning. They usually don't eat in the morning. And this is caused by melatonin. And like I said, the problem with falling asleep results from melatonin shift, and that's why many people with ADHD need melatonin as the treatment of their sleep problems. Girls and women with ADHD often internalize their problems. This is very important, because if you have a daughter with ADHD, do not expect her to come to you and tell you that something bad happens or happened at school, because she will be much more likely to keep it to herself, not say it, and after a year or 2 or 3, she is very prone to develop depression because of that, because instead of sharing their problems, they keep it to themselves. And so this is called internalization. Of course, this also leads to increasing internal tension, because all these emotions that normally should be let out, should be shared, they keep it to themselves, so it increases tension, internal tension. And with time, for example, in adults, in women with ADHD, this translates into high muscle tone, and many of them go to doctors because they feel tense, and they cannot rest. And this is called by this emotional, maintaining emotions inside. Of course, this also negatively impacts social interaction and, for example, maintaining relations, because they will keep the problems to themselves instead of sharing them with their partner, and this sometimes may lead to misunderstandings and splitting up, let's say. It is quite common to think, even many specialists still think that girls with ADHD are not hyperactive, so that most of them or all of them have only low energy levels. In fact, it's much more common for boys with ADHD to show gross movements, while girls and women with ADHD have minor, small movements of their hands. They shuffle feet. For example, their leg quite often rhythmically trembles, or they move their fingers, they play with their hair, or bite their nails, or bite the inside of their cheeks. So there are many small movements, small repetitive movements that they make, and it's not that they have to run around the room, let's say, or any other place. They just have very small movements quite often. They also quite often change positions when they are talking or when they listen to something. And usually this excess of energy that normally in boys translates into movement all over the room, let's say, this translates into racing thoughts. So girls and women with ADHD quite often have racing thoughts, lots of thoughts. Some of them say, "Doctor, I have a radio in my head, someone is switching the channels, and every 5 seconds I think about something else," and so the subjects jump from one to another. Some women and girls with ADHD, when they feel that they have lots of energy, let me remind you, I told you about different energy levels. So each ADHDer has sometimes has lots of energy, sometimes has no energy or little energy. The same person has both of those states, but different people will have those states with different frequencies. So some people may mostly have lots of energy, while other mostly will have little energy. So like I said, when those girls, the time comes when they have lots of energy, they get excited for, let's say, by something, then they sometimes feel the need to talk much and in excess, let's say, loudly, and sometimes it's hard to stop them from talking because they just feel this urge to talk all the time. Women and girls with ADHD quite often show risky sexual behaviors. There are a few reasons for that. So for example, one of the main reasons is impulsivity. So they make a decision impulsively, sometimes without thinking about the consequences of their decision. And sometimes, as I said, that they have DESR and that it is more pronounced in women than in men. So they are prone to being judged, and so they really care what the other people are thinking about themselves. They want to please other people because they want those other people to think positively about those girls, and for this reason sometimes they get into those sexual behaviors to please other people. And so the studies that I show you here below on the slide, those studies show that they often start their sexual activity early. They have many or more partners than women in the general population. They more often make unprotected sex. And until the age of 30, 43% of women with ADHD have unplanned pregnancy, while only 10% in the general population. So as you can see, more than 4 times more unplanned pregnancies among women with ADHD. Sensory hypersensitivity is a feature present in both genders, but women with ADHD have more hypersensitivity to different senses. Of course, you probably know that this sensory hypersensitivity results from depletion of dopamine level. If you want me to tell you more about it, please comment below, and I will record a lecture on dopamine and dopamine significance in our brains, or a dopamine role in our brains. But one of the roles of dopamine is selection of signals or sensory signals, for example, that come to our brain. And without dopamine, different signals from different senses may be increased in their sensitivity or in their intensity, or decreased. And so this is unbalanced reception of signals sometimes results in sensory hypersensitivity, and women with ADHD have it, and quite more pronounced. Another result of ADHD in girls and women is self-harm and suicidal attempts, unfortunately. And quite many girls with ADHD harm themselves, especially if ADHD is not diagnosed. So this is why my job here, and this is why I tell you about it, because I want everyone to know what is ADHD in girls, and please try to find it among your relatives, so among girls that you know, because quite often those girls, as I've shown you, among girls only 20% of patients with ADHD are girls, 80% are boys, and so we should look for those girls and help them. So like I said, girls with ADHD have internalization, so they internalize their emotions, negative emotions, and they accumulate the tension, and this sometimes results in self-harm. As much as 50% of girls with ADHD, with those with mixed subtype, and 30% of those with attention problems harm themselves. So as you can see, 30 to 50% of girls with ADHD. Until the age of 20, 23% of girls with mixed subtype and 8% of girls with attention problems will make serious suicidal attempts. Those girls with ADHD who have strong DSR, the emotional dysregulation, very negatively feel and perceive what the others are saying about themselves, and they live in constant trauma. Maybe you know that there are 2 hormones that are secreted during the trauma, and these are adrenaline and cortisol. And cortisol is a hormone that strongly negatively impacts female sex hormones like estrogen. So if someone is in trauma, their estrogen hormone level will be suppressed. For this reason, probably, this is not very well studied. Actually, there are very, very few studies on that. But probably because of that, quite many girls with ADHD have gender dysphoria, so they cannot identify or as girls or boys, or they cannot identify whether they want to get involved with girls or boys. This is quite common among girls with ADHD, especially those with low energy levels, because as you remember, I said that low energy level correlates with strong emotional dysregulation. Girls and women with ADHD have numerous coexisting disorders. This is the problem from the very beginning that is hindering diagnosing ADHD in girls and women, because they have anxiety, they have mood disorders, so depression or bipolar, they have eating disorders, they have conduct disorders, they have personality disorders, quite often borderline personality disorders. And these disorders are coexisting. In many cases, they derive from untreated ADHD, and this is why it's so important to treat ADHD. Girls with ADHD tend to abuse electronic media, so they are very prone to using electronic media. They love using their phone or watching television or using the computer, and this often aggravates or make it more difficult to fall asleep, for example, during the evening, because they want to use social media, let's say, and they cannot fall asleep, especially if they shine the light from the phone onto their retina, and this will make secretion of melatonin, the problem, which is problematic, the hormone, that is problematic, like I said, in ADHD, and this shining the light on retina will make it even more difficult for the brain to secrete melatonin, and so this will of course aggravate the problem with falling asleep. And because of that, if they cannot sleep well during the night, the next day, of course, they will have a problem at school, because if you don't get enough sleep and you have ADHD, like this is almost sure that you will have a lot of problems during the day, because you will get even more difficult. It will be even more difficult for you to be concentrated and not to get distracted if you didn't get much sleep. Of course, because of this problem with using social media, they also have a problem with dysregulation of the day-night rhythm, because like I said, they use social media early in the night, and this will change, or this will shift the time when they want to be active and when they want to sleep. So sometimes they sleep until 3 in the afternoon, let's say, and then they are active until 3 in the night. And this is not good, because we humans are supposed to sleep during the night, so when it's dark we are supposed to sleep. There is a very interesting theory that says that we should sleep during the night, And if you want, I can also give a lecture on that, or tell you about that in a separate video. Very interesting why humans should sleep during the night, because many patients come and say, "Doctor, what's wrong with being active during the night and being sleeping during the day?" Believe me, it's bad, especially if you have ADHD. Another thing that's connected with ADHD in women and girls is that a large portion of them, a large percentage of them are obese or overweight. It comes with ADHD, so ADHD causes obesity in a larger percentage of women with ADHD than in the general population. Some of those girls and women will notice that they have tendency to get obese, and they will, right in their childhood, that they will notice that. And sometimes this leads to eating disorders, because they want to eat, because they see that even if they don't eat much, they quite easily get obese. So that's why eating problems are one of the problems that are associated and probably caused by ADHD. So there are studies showing that among girls with ADHD, there's more of them have eating problems than among girls without ADHD. As you can see, there's a very good study from last year showing that in the population of girls and women with ADHD, their average BMI is much higher than the one in girls and women without ADHD. As you can see, those two lines tend to, the difference between them tends to widen, because there's much higher difference with time, with age, between those with ADHD and without ADHD. Another feature quite characteristic, this one is, I would say, really characteristic for women and not men with ADHD. I mean, of course, some men also have it, but mainly it's for women with ADHD, is compulsive shopping. So people with ADHD do not have sufficiently high level of dopamine, and they are constantly searching for dopamine whatever they do. And one of the ways how to increase the level of dopamine is to do shopping. So this is something that quite many women with ADHD do, and of course this is caused by impulsivity and by the searching for dopamine source. Now, this is something very important, I would say. When we think about ADHD, and we usually think about a chaotic person that gets easily distracted and cannot finish the job, get something done. We forget that sometimes ADHD shows as perfectionism. So some women, when they see that they have a problem with their life being chaotic, they develop this tendency to get everything perfectly done. Because I just have to keep everything in order, because I have a problem with not keeping everything in order. So from now on, I will keep everything in perfect order. So perfectionism is actually one of the faces of ADHD, especially in girls and women. So sometimes this becomes a habit, and of course, as you probably understand, this will lead to anxiety, because the more I try to control my life, the more I will see that I cannot control it. And this leads to anxiety, mostly anxiety, but sometimes also depression. Girls and women with ADHD have more symptoms during puberty, so quite often it happens that a girl will go through elementary school getting good grades without problems in their behavior, but then when they get 12, 13, 14, 15, and they go through puberty, and before they were interested, you know that an ADHDer is interest driven. So ADHDers do everything or most things in their life because they are interested in something, and they cannot do things that they are not interested in. So if a girl is interested in learning, then she will go through her school until some time with good grades. But then when puberty hits, when there's a shift in interest, because then boys or girls are much more interesting for them than learning, then they get worse grades, they skip school, and the problem starts. So in many girls, the problem starts in puberty. Of course, this is also caused by hormonal changes, more directly caused by hormonal changes, as I will tell you in a moment, that the female sex hormones strongly affect the level of ADHD symptoms. Because of hormonal changes during puberty or then during adulthood, different age groups of women present with different symptoms. And as you can see, first in the age group of 0 to 9 years, the most problematic are emotional dysregulation, concentrating, or social problems, and then 10 to 19 years old say that it's procrastination, emotional dysregulation, time management. 20 to 39 years old say it's procrastination, feeling overwhelmed, and time management is problematic. Then 40 to 59 years old say it's feeling overwhelmed, brain fog begins, memory problems and time management, and those older than 60 say that the main problem is brain fog, memory problems, procrastination, and feeling overwhelmed. Why are there problems diagnosing girls or women with ADHD? So the main problem comes from stereotypes. So many of those specialists who do not specialize in ADHD, so psychiatrists or psychologists, still think that ADHD is mainly a problem of boys, young boys. And as girls are usually calm or often too calm, they of course cannot have ADHD. And another thing is that ADHD is only present in another stereotype is that ADHD can only be present in children and not in adults. And this is another problem because women with ADHD cannot get diagnosed because, like I said, this disorder is thought to only be present in girls. Girls with ADHD have several methods for not showing that they have a problem. Why should they not show that they have a problem? Because they have DESR, they have emotional dysregulation, they are very sensitive to being judged. They don't want to show that they have a problem. So there are several ways how to do it, and the first one is to try to do everything as ordered or as expected. And many of them, for many years, manage to be good girls, to do well at school, to keep the room tidy. Usually until puberty hits, they manage doing it, even if they are very tense and they put a lot of effort into it, but they manage. The second method is to get perfectionist. So if I try to do everything perfect and keep everything under control, then I might, nobody will say that I do something wrong. Of course, everything is very good, is perfect, to be honest, and then no one will notice that I have a problem, of course, until I develop anxiety or depression. Another method for not showing that I have a problem is withdrawal. So I will stay in my room, not talk to my parents, not talk to my peers, or maybe to one or two, or have a friend on the internet where I feel safe and I don't feel judged. And I will withdraw from social interaction, not to show the world around that I have a problem. Of course, this will also lead to accumulation of the tension and probably anxiety and depression. Another another reason why ADHD is often not diagnosed is that most or many of the members of the family usually also have ADHD. So I see that other people have the same problems. So probably everyone has the same problems. It's only me who cannot cope with those problems. So this is another reason why I will try to hide it, internalize it, and not show it to the world that I have this or that problem, because I'm just lazy. I cannot do it. I cannot cope with it. And this is my problem. I don't want to show it because I am hypersensitive to being judged. And also my parents or people in my family will also notice that I have the same problems as they have, and this is normal, and that this is not a reason to go to a psychiatrist or psychologist. So I should just keep my head together. I should just try to cope with the problem myself and not go to anyone else, to some specialist. Then another reason why ADHD is poorly diagnosed in girls especially is that there are different questionnaires or resources for clinical assessment, and those tools are quite often based on the symptoms that are present mainly in boys. So as you can see, there are only few of them that are good for both genders and that we should use for diagnosing in both girls and boys. Another problem is that physicians, like psychiatrists, when a girl or woman comes and says that she has depression, they will start treating depression, and they will only think about depression and not about the underlying cause of this problem, in this case ADHD. So they will deal with the surface of the problem instead of going deep. And this is quite a big problem, because studies show that an average ADHDer, until the time that she is diagnosed, will have taken several or 7 even antidepressants, because before someone diagnoses ADHD in this person. So as you can see, for many years people are not diagnosed and take many different medications, really many. I know lots of patients who were taking like 40 medications in their life, none of them working, or not, at least not working well, and until the time that they were diagnosed with ADHD. In the effect, ADHD is underdiagnosed, of course, and as you can see, only about 4.9% of women with ADHD are diagnosed, and around 12.9% of men with ADHD. So when should we think about ADHD in women? Of course, one of the main red flags is when there's somebody else in the family with ADHD. ADHD is a strongly genetic disorder. Having a relative with ADHD increases the risk 2 to 8 times, so many times. This is an excerpt from the study that you can see below, and it says that it should be noted that a family history of documented or suspected ADHD should raise the clinical index of suspicion regardless of gender. However, in the case of a female patient presenting with behaviors characteristic of ADHD, it should serve as an indication that ADHD may be the primary condition rather than any other psychiatric disorder. I want to stress this very strongly. So we should think about ADHD in any woman that presents in the psychiatrist's office. Another point or another case when we should think about ADHD is the girls with learning problems. So even, like I said before, even if they get good grades until sometime, usually until puberty, then their grades get worse and they need help doing homework, for example, because ADHDers concentrate much better when they concentrate with somebody else in pairs. So we should think about ADHD when a girl has a problem, let's say, doing homework or learning. Please remember that they will usually not ask for help because of internalization problem and because of being afraid of being judged. We should always think about ADHD in the case of those girls or boys actually with oppositional defiant disorder, which is ODD. ODD is more prevalent in girls with ADHD than in the general population, and interestingly, this oppositional disorder usually happens between a girl and her mother, more often than the father. We should think about ADHD in the case of risky sexual behaviors. Like I said before, because of impulsivity and because sometimes they try to please other people because of emotional self-regulation or deficient emotional self-regulation. Those girls usually show risky, or quite often at least, show risky sexual behaviors, and in this case we should think about ADHD. And the study below shows that if teachers evaluated the behavior of girls and boys with ADHD, they said that 44% of girls and only 28% of boys are promiscuous. And girls with oppositional defiant disorder have much higher risk of getting pregnant before the age of 20. What are the coexisting disorders? I said it 2 or 3 times already. So depressive disorder, anxiety disorder, problems with learning, or eating disorders and personality disorders. These are the most important ones that coexist with ADHD. Quite often they stem from ADHD. So right now I will only tell you about a few of them in detail, so or more, I will give you more details on those. And eating disorders, like I said, happen quite often with ADHD in girls, especially because first of all they see that they have a problem with getting overweight. But also because of the melatonin shift. So if they cannot eat until noon, then they get a lot of appetite in the afternoon and especially in the evening. And if they are impulsive, when they finally get their appetite back and they are impulsive, this leads to binge eating, often in girls with ADHD. So, as you can see, a large meta-analysis of recent studies showed that women with ADHD have 4 times higher risk of anorexia, 6 times higher risk of bulimia, and 4 times higher risk of binge eating. Personality disorders quite often coexist in people with ADHD, and one of the most prominent one in ADHDers is borderline personality disorder, and there's a whole story behind it. I just want to stress this fact that borderline personality disorder quite often coexists with ADHD. If you want to know my theory on why and whether we should at all talk about borderline personality disorder in this case, please give me a note. So write it in the comment below. I think it's quite interesting, the fact of emotional dysregulation in both of these disorders is very important, and it might show us that there's something going on with coexistence of BPD and ADHD. I said it before that women with ADHD have that hormonal changes in women with ADHD affect their ADHD. And this is because estrogens increase dopamine activity. So estrogens decrease the level of ADHD because ADHD is loss or lack of dopamine. So as you can see, estrogens increase the activity of dopamine enzymes, so they increase dopamine synthesis, they induce dopamine release. They block reuptake of dopamine, so the reuptake of dopamine is a kind of loss of dopamine from the synaptic cleft between 2 neurons in the brain. So they block the loss of dopamine, so this way they increase the dopamine level. They also increase the density of dopamine receptors. So as you can see, estrogens decrease the intensity of ADHD. On the other hand, progesterone, the hormone that is secreted in the second part of menstrual cycle just before menstruation, this hormone increases the symptoms of ADHD. This is why in the second part of menstrual cycle, women with ADHD, or at least some of them, have stronger symptoms. And this is also the reason why during the puberty, the problems connected with ADHD exacerbate and get more serious, because the female sex hormones are secreted in higher levels, and for this reason some of them, progesterone, increases the intensity of ADHD. Those problems also manifest during menopause because the estrogen level decreases and ADHD symptoms get worse. Of course, the same or similar problems to ADHD may show up in women because they just show up because of age. Of course, the same problems like memory problems, attention problems, executive function problems may show up in women with ADHD during menopause for other reasons. And we should also mind that and remember about that. Is there some way how we can ease the ADHD intensity in those women who feel very strong exacerbation of ADHD in the second part of menstrual cycle? There are some studies that say that women with ADHD may take hormonal contraception and it will help them with their ADHD symptoms caused by hormonal changes. But unfortunately, the same treatment will increase the chance of depression or risk of depression 5 times. So this is unfortunately problematic. Motherhood in women with ADHD is also problematic quite often because I said it before that women with ADHD try to fulfill their roles in the society, so try to be a good mother, a good wife, but it's quite difficult for them because they get quite often easily irritated, they are impulsive, they have problems doing repetitive tasks and labor-intensive tasks, for example, when they have low energy level. So this causes a problem, and we should also remember that often their children also have ADHD, and in this case it will be even more difficult for them to fulfill their role. On top of that, women with ADHD, when they get pregnant and when they go into labor, they have quite a lot of complications. And as you can see, for example, they have 33% higher risk of hypertension in pregnancy. They have more than 30% higher risk of renal disease. They have postpartum depression 80% more often. They get depressive episodes 163% more higher risk. Diabetes, preterm delivery, spontaneous abortion, so quite a lot of complications. So we have to look carefully at women with ADHD and all those complications. We should, as I always say, it's we should know that we have ADHD if we have it, because if I know that, then I can prepare and I might know what I should expect. As you can see on this graph, these are all these complications and how high is the risk in women with ADHD. So you can see on the axis below 1 to 3, this is the risk. So 2 means 2 times higher risk, 3 times higher risk in women with ADHD. And as you can see, preterm birth, malnutrition, spontaneous abortion, pre-existing hypertension, cardiac disease, renal disease, TORCH, eclampsia. So all these problems happen more often in the women with ADHD. Luckily, when these women are treated for ADHD, then the risk decreases strongly, really strongly, as you can see. So, as you can see on this graph, when those women are treated, the risk is lower, much lower. The risk of practically all of those complications, only except for HPV infection, everything else decreases, strongly it decreases when those women are treated for ADHD. So this is a strong argument for being treated for ADHD, also in pregnancy. I said before that during the second part of the menstrual cycle, when progesterone is secreted in high level, women with ADHD have strong symptoms of ADHD. Many of them don't take medication during that time because they should say, doctor, whether I take it or not, it's just the same. It doesn't matter whether I take the ADHD medication. In fact, in women with ADHD, they more often have not PMS, not premenstrual syndrome, they have PMDD, which is a stronger version of PMS. And what's the difference between them? So the severity of symptoms is more pronounced in PMDD, and impact on life is much higher. And as you can see, PMDD is much more prevalent in women with ADHD. So 45.5% of women with ADHD have it, while in the general population only 28% of women have it. Interestingly, women with ADHD use hormonal contraception much less frequently than women in the general population. PCOS, polycystic ovary syndrome, is another syndrome or condition connected with ADHD. So women with ADHD should know that they have a much higher risk of PCOS. We still don't know why it's associated, but we know that it is. And also children of women with PCOS have much higher, 50% higher rate of ADHD. What are the other problems, health problems connected with ADHD? So there's lots of them. There's lots and lots of them. And so I just wanted to tell you about a few, the most important ones that everyone should remember, like allergy and asthma, like headaches, much more frequent, 2 to 3 times more frequent headaches in people with ADHD, like epilepsy or at least abnormal EEG, and obesity that I mentioned before. How should we treat ADHD in women? There are guidelines, especially for women with ADHD. They were written 3 years ago, so I thought that it might be a good idea to show you at least some of the excerpts from those guidelines. You can check them yourself, but I just wanted to show you a few points from those guidelines. Let me read them. So ADHD is typically treated with psychoactive medication, psychoeducation and therapeutic interventions at all ages, and the stronger treatment effect has been reported with multimodal treatment. This is very important. This is something that I teach all the time, that no pill will relieve you of ADHD. So let me rephrase it. Only if you use different types of help for ADHD, then you get good results. Where mood problems are apparent but not pervasive, it is advisable to treat ADHD symptoms and monitor for improvement first, prior to considering or initiating treatment for mood disorders. This is something that many psychiatrists miss. So we should first treat ADHD instead of mood disorders like depression. Parents and carers of teenage girls need psychoeducation to support detection of deliberate self-harming or risky behavior. This is the result of what I had said before, that unfortunately up to 50% of girls with ADHD harm themselves, and so we must be mindful. Programs should differ depending on age, with issues relating to transition. As far as pharmacological recommendations are concerned, medication recommendations do not differ by sex and differ only modestly by age. The potential benefits of treatment must be viewed in the context of lifetime adverse outcomes associated with poorly managed ADHD. So this is a reflection of what I had said, that not managed or not treated ADHD quite often leads to depression and all those other disorders. Prompt identification and treatment may help to improve longer-term functional health and mental health outcomes. Reduced rates of comorbidity, including depression, anxiety, and disruptive behavior disorders, have been noted in stimulant-treated ADHD populations. So, in other words, it's good to treat those women and girls with stimulants because they bring long-term effects. Sorry, it's in Polish, it's pharmacological treatment. So comorbid ADHD is associated with treatment-resistant depression, and regular treatment for ADHD may reduce rates of treatment resistance. Once again, we stress, sorry, not we, because I didn't participate in the writing of those guidelines, but those who have written it say that if we do not treat ADHD, then we may have a problem treating depression. And pharmacological treatment of ADHD is also associated with improved educational and occupational outcomes, as well as reduced rates of criminality. Pharmacotherapy for ADHD appears to be a protective factor for obesity. This is probably an interesting point of many viewers, because as you can see, also in many cases obesity may be managed by treating ADHD. If you want to hear more about what stimulants or ADHD medication, how it can benefit a person with ADHD, because we collected all these data, and we tried to summarize it, and I have a lecture or video on it in Polish, but I can record it in English if you want. Please comment, once again, please comment, and I will make a video about it. I think it's very interesting, and as I usually say, every parent of a child with ADHD should know about all those things that medication for ADHD may bring to their life or the life of their children. The consensus group observed that prescribers need to consider ADHD presentations and associated problems in females to appropriately target what medication aims to improve. It may be less helpful to strictly adhere to conventional rating scales or focus on behavioral management to identify treatment-related changes. Instead, treatment response may be better captured through individualized targets, such as measures of emotional regulation, participation in education, and academic attainment. So we should listen to the patients, and we should ask them whether they see improvement. And If not, we should modify the treatment instead of using rating scales or focus on behavior management, because the patients know, or the girls in this case, know what's good for them, and we should adjust the treatment accordingly. So in the summary, I wanted to say that, I want to remind you that ADHD is different in women than in men. Unfortunately, it is still less frequently diagnosed in the population of women. ADHD has many features in women characteristic for this population, and for example, some of them are low self-esteem, high emotionality, difficulty in maintaining relations, distractibility. Some girls or women with ADHD develop masks, and these may be, for example, social withdrawal or perfectionism. ADHD is very frequently coexists with numerous other psychiatric disorders, and ADHD in women is strongly associated with hormonal changes. Like I had said before, on Facebook I have a group for my English-speaking patients. It's called Alma ADHD in Adults. I welcome you to the group. Please join it, and so we can exchange the knowledge on ADHD, facts on ADHD. I always try to make sure that everything we write or people write on those groups is proven, and you can, I hope, you can only find facts on ADHD in those groups. So I think and I encourage always my patients to join those groups to learn more about ADHD. Thank you for today, and please leave a comment if you want to know something else, something more about ADHD.